So hello everyone, welcome to Health and More. This is your official YouTube channel for my blog. Today I'll just be taking a few minutes of your time to talk about polycystic ovarian syndrome, that's PCOS. I'm just going to leave some tips on how to take the history, the diagnosis, investigation and management. And everything I'll talk about, I'll talk about it based on PCOS, that's the acronym. Now in the history of PCOS, before you would begin, we'd like to understand what is PCOS all about. It's basically a condition in which a woman has difficulty or there are abnormalities in the metabolism of androgens and estrogen. There's also some problems with how the androgens are produced, meaning there could be overproduction of androgens. Now in the history of a woman with PCOS, first of all show you the picture of what they look like. Yes, you can see the picture. Based on the PCOS acronym, the history, you're going to ask about the P, which is poor fertility. There's always a history of infertility in these women. There's also a history of poor menses, which could manifest as oligomenorrhea or amenorrhea. There's also the C, which will be problems with hair. Like, think of it like curly, furry. There's hirsutism, a lot of hair growth in these women. And then for the O, we have obesity and metabolic syndrome. They have from the obesity, they are also prone to having obstructive sleep apnea. And for the S, which is sugar, they are prone to having diabetes. So that is it. You have to ask and elicit these symptoms: PCOS, oligomenorrhea from the P, infertility, obesity, obstructive sleep apnea, where you ask them about feeling tired during the day, and then diabetes, peeing excessively and eating excessively. Okay, so we're done with the history. We're moving on to how do we make a diagnosis. Okay, so the differentials for PCOS, I'm going to talk about them using the acronym PCOS. P for prolactinemia. Hyperprolactinemia is a differential. C for congenital adrenal hyperplasia. O is for ovarian tumors, and these tumors secrete androgen, so we also say androgen secreting tumors. And the S is silly. There is no reason. Idiopathic. For the diagnosis, we have to remember that I'm going to use this acronym, and I'm going to use it on all my videos from now on. So if you keep watching, you'll learn that it's very simple, easy to remember how to do your test in all your patients using this simple mnemonic: BSUX, BESUX. Now if it's a woman, I'm going to add the P at the beginning, and for every condition I'm going to put the S. So let's just say P BSUX. The P only works when it's a female. Now in PCOS, because it's a female, we'll start with the P, which is pregnancy. We have to rule out pregnancy, and that is done with the beta HCG test, which could be from the serum or the urine. And then when we're done with that, we move on to the B, which is the blood work. We're going to do our CBC, complete blood count. For the electrolytes, we will do everything that basically has to do with the serum, from the basic metabolic profile to the lipid profile, as well as the OGTT. Then we're also going to check in the S, it stands for stool, but we're not going to do anything with that in this case because PCOS has nothing to do with the stool. And in the urine, we're going to check for the 17 keto steroids, which will be done with the 24-hour urine keto steroids. We'll also do the 24-hour cortisol. Now for the X, which is the X-ray, or you also call it imaging. The imaging we're going to do for PCOS is going to be the pelvic ultrasound, which will show the strings of pearl sign. For the S, which means specific tests, these are the tests we're going to do to confirm and to rule out our differentials, because PCOS is affects the hypothalamic, pituitary and ovarian axis, the HPO axis. The test for confirming it is going to be centered around the pituitary. So we're going to check all the hormones there, from the TSH to the FSH to the LH to prolactin. Then to rule out other conditions such as the congenital adrenal hyperplasia, we're going to do the testosterone, the DHEA. that's, we're done with the investigations. Now we're moving on to management. As I said earlier, I'm going to talk about management based on PCOS. Now for the PCOS, in terms of P, we're going to pluck the excess hair, which we talked about. They have a lot of excess hair, hirsutism. So we could do that in different ways. We could use waxing, we could use shaving, and we could also use some other medical treatment. Now for the C, if the woman desires to be pregnant, we'll give her clomiphene citrate. And for the O, we're talking about OCPs because we said they have oligomenorrhea and amenorrhea, so we'll give them the OCPs to regulate the menses, and because they are exposed to a lot of estrogen, so the OCPs will help reduce the duration of exposure to the estrogen, which has a negative effect on the uterus. You know what we mean by it causes endometrial hyperplasia. Now for the S, which is sugar. They are prone to having diabetes, so we're going to give them metformin to control their symptoms. If it proves really stubborn, we could go as high as insulin. So thank you so much for watching this video about PCOS with me. I hope you like this video, and if you do, please leave a thumbs up, like, share, and subscribe.